This is the story of a man named Ignaz Semmelweis. He lived in 1846 and was a doctor from Hungary. He had ideas that could have saved many women and babies from getting very sick. At that time, doctors were learning more about science. They no longer believed that bad air or evil spirits made people sick. Instead, they studied the body and used numbers and data to understand health better. When Dr. Semmelweis started working at a hospital in Vienna, he noticed something surprising. Many women in the maternity ward were dying from a sickness called puerperal fever or childbed fever. He wanted to know why this was happening. He looked at two different maternity wards in the hospital. One was run by male doctors and students, and the other was run by female midwives. He counted how many women died in each ward. Dr. Semmelweis discovered that women in the doctor's ward died almost 5 times more than those in the midwife's ward. He wondered why this was true. He checked what was different between the two wards. One big difference was how the women gave birth. In the midwife's ward, women gave birth on their sides. In the doctor's ward, they gave birth on their backs. Semmelweis decided to try having women in the doctor's ward give birth on their sides too. But this change did not help at all. Semmelweis noticed something strange. When a woman died from childbed fever, a priest would walk through the doctor's clinic, ringing a bell. Semmelweis thought the priest and the bell scared the women after they gave birth, which might have made them sick. To help, Semmelweis asked the priest to change his route and stop using the bell. But this did not help at all. Semmelweis became frustrated. He took a break from work and went to Venice, hoping that art would help him think better. When he returned to the hospital, he learned some sad news. A doctor who studied sick bodies had become very ill and died. This happened often, as Jacqueline Duffin, a teacher of medicine, said. She explained, this often happened to pathologists. There was nothing new about how he died. He pricked his finger while doing an autopsy on someone who had childbed fever. Then he got very sick and died. Semmelweis noticed that the doctor had the same symptoms as the women who were sick. This was a big discovery. Childbed fever could also make other people in the hospital sick. But he still didn't know why more women were dying in the doctor's clinic than in the midwife's clinic. Duffin said the doctor's death gave him a clue. The big difference is that the doctors were doing autopsies and the midwives weren't. Semmelweis thought that when doctors touch dead bodies, they might get tiny bits of dead body on their hands. When they help deliver babies, these tiny bits could make the women sick and cause them to die. If Semmelweis was right, cleaning away these tiny bits should help lower the number of deaths from childbed fever. So he told his medical staff to clean their hands and tools with a chlorine solution, not just soap. Today, we know that chlorine is very good at killing germs. Semmelweis didn't know about germs. He thought chlorine would help remove bad smells from the dead body bits. When Semmelweis made the change to wash hands with chlorine, the number of childbed fever cases dropped a lot. What he discovered is still true today. Washing hands is very important for keeping people healthy. It helps stop kids from getting the flu, prevents the spread of diseases, and keeps infections away. You might think everyone would be happy because Semmelweis solved the problem. But they weren't. Doctors were upset because Semmelweis' idea suggested they were making the women sick. Also, Semmelweis was not careful with his words. He publicly criticized people who disagreed with him, which made him powerful enemies. In the end, the doctors stopped using chlorine for hand washing and Semmelweis lost his job. Semmelweis tried to convince doctors in other parts of Europe to wash their hands with chlorine, but no one listened to him. Even today, getting healthcare workers to take hand washing seriously is hard. Many hospital patients get infections each year, which can be very dangerous. The Centers for Disease Control and Prevention say that good hand hygiene is one of the best ways to prevent these infections. Over time, Semmelweis became angrier and acted strangely. Some think he got a mental illness, possibly from syphilis or Alzheimer's. In 1865, when he was only 47 years old, Ignaz Semmelweis was sent to a mental hospital. The sad end to his story is that Semmelweis was likely beaten in the mental hospital and eventually died from sepsis, a serious infection in the blood. This was the same disease he worked hard to prevent. It caused the deaths of women from childbed fever.